We are back Monday morning here on BT, talking about the great work being done at VGH inside the emergency room. Dr. Chad Kim Singh is back, just a step up from the scrubs today. Nice to see you dressed up. Director Kevin Eastwood joining us too, and we are talking about the success of this series, telling the stories inside the emergency room. And before we talk specifically about the show and the dynamics, this series finale episode focuses on New Year's Eve. Unique challenges, Dr. Kim Singh, you see on that night.
It's interesting, right? It's a culmination of many things on New Year's Eve. So you have anything that comes to the doors like we usually have. And then you also have parties. You've got bad weather. You've got intoxication. You've got fights. You've got the lows of the season where people are just feeling lonely and so forth. So we see the gamut all the time, but you really do see some differences at this time of the year, and I think the viewers will really get a closer look at everything that happens in an ER and the impact that it has on the society and the community during the New Year's time.
And as we take a close look at this show and seeing what your life is like, Kevin, there is a terrific educational component of this vital work being done. 5 million impressions for this series online and on air. How has this show changed the way you look at life and look at the work being done at the hospital?
It's hard to quantify it because it's honestly been a fundamental change. We made 3 seasons of the show, and we saw a lot in that time. And it's hard to express just how transformative it is to see that many people's lives change. Like we're there at the title says it all, life and death moments, and to be at the present for a stranger's end of life moment is a really impactful moment, because even if you didn't know them, you now know you're in kind of special company of the people that are present. And so there's a great kind of responsibility that comes with that, but also you realize kind of the human connections that you make in those moments. And you see also the healthcare staff, the emergency room staff, doing that on a regular basis, and you realize there's so much more than just all the science behind it, that just kind of the compassion and the acts of humanity that are on display in there that are kind of beyond the scope of their job description, but that's what they provide, and that's really powerful to see.
Well, to see it played on the small screen is interesting, and for you, Dr. Kim Singh, and the staff, when you see your efforts portrayed on screen, is it a great sense of appreciation when you see the reaction from people that digest this show and truly understand what you deal with day to day?
I think so, and it's not only that, it's the pride that our staff feel for each other. And so day to day, the work we do, that's what we're trained to do. We're a well-functioning, highly functioning team. When you can take a step back and see, on a screen what each of your team does and your colleagues, it's just another feeling altogether. So much pride, boosting of morale and so forth. Now, I think for viewers as well, it helps with the learning, the understanding of what we do, our healthcare system, the bigger picture issues. But certainly it has impacted in a positive way, I think, some of the interactions we have with the patients now that they understand what the Emerge is for, the work that we do, the pressures that we face and the challenges. But for myself, I find it really rewarding when patients take the time to give us feedback about the Emerge in general, not just the show, but they learned more now, they plan to do things differently, maybe live a healthier lifestyle, see their family doctor more often. Just the impact that it's had from that has been phenomenal.
It's almost an indirect call to action with what they're seeing on screen and what they can do differently. And quickly, if we could get your take on what is happening with the opioid crisis. The federal government says over the next 5 years, $65 million invested to help battle this problem, $10 million specifically in BC with that sense of urgency. What is the answer? What are we seeing on the front line of how to change this culture altogether?
That's a fantastic question. It's a difficult question to answer. There are many, I think, great things happening in this overdose crisis as far as addressing the resources needed and addressing the care gaps that there are. I think if you look at the cycle of addiction, you need to understand that and figure out, well, how do we break into this cycle in a meaningful way, in a sustainable way? And part of that is having resources in the community. So, for instance, the downtown east side, where the clientele there actually want to stay and have care in the community. Other issues maybe even further upstream. So healthy built communities, jobs that are available, education in school, building a resilient community, I think will help even prevent us even getting into this type of a crisis. So lots to be done, and I think there's a lot of good work that will be done.
Well, you've done great work on this show, Kevin. Series finale goes tomorrow night?
That's right. Tomorrow night, Tuesday night at 9.
9 p.m. Knowledge Network. You can check it out. Congrats to you both for
so
showcasing the vital work being done.
Thanks for having us.
Okay, thanks for dressing up too. Appreciate the 3-piece suit. Killing me with this.